Here's a question most men avoid asking themselves. When was the last time you made it through the night without getting up to use the bathroom? Finished urinating without that annoying dribble at the end? Felt like you actually emptied your bladder completely? If any of this sounds familiar and you're over 60, pay very close attention because there's a 30-second test you can do in your own bathroom that reveals exactly what's happening with your prostate, and most men have no idea it exists. Before we get into it, do me a favor. Hit that like button and drop a comment telling me where you're watching from. I want to know I'm reaching men who are ready to take their health seriously. Here's what your doctor probably isn't telling you. Frequent bathroom trips, weak stream, and that feeling of never fully emptying, these aren't just normal aging. They're early warning signs that something needs attention. I'm Dr. Jocelyn, and I've spent 5 years as a urologist helping men understand what's happening in their bodies. The biggest problem I see isn't the prostate issues themselves, it's that men wait way too long to pay attention. Why? Because we've been conditioned to think, I'm getting older, this is just what happens. Sure, prostate enlargement is common, but common doesn't mean you have to suffer. And ignoring the warning signs is the worst thing you can do. Your prostate is roughly the size of a walnut when you're young. As you age, it can grow to the size of a lemon or larger. When it does, it presses against your urethra, the tube that carries urine out of your body. That's when symptoms appear. Here's the critical part. The size of your prostate doesn't always match the severity of your symptoms. Some men have large prostates with almost no problems. Others have moderate enlargement with serious complications. That's why this simple bathroom test matters. It gives real, observable information about your urinary system, not guesses or assumptions. In my years of practice, I've diagnosed prostate issues in thousands of men. The ones who catch problems early, they have options. They can adjust habits, make lifestyle changes, and sometimes avoid medication or surgery altogether. The ones who wait until they're desperate, they're stuck with more invasive interventions. Today, I'll teach you the exact test I use with patients to assess urinary flow and prostate function. Then, I'll cover 5 warning signs that mean you need to take action immediately. Stick around until the end, because I'll also reveal the one habit most men do every day that makes prostate problems worse. The test is called the urinary flow self-assessment, and it's remarkably simple. Next time you need to urinate, ideally with a full bladder, follow these steps. Step 1, note how urgently you need to go. Is it a gentle nudge, or does it feel desperate? Step 2, observe how long it takes for the stream to start. Does it begin immediately, or do you have to wait or strain? Step 3, watch the strength of your stream. Is it strong and continuous, or weak and interrupted? Does it start and stop? Step 4, time how long it takes to empty your bladder. For most men with healthy function, a full bladder empties in about 15 to 30 seconds. Step 5, wait 10 seconds after finishing. Do you feel truly empty, or is there urine still left inside? Step 6, notice any dribbling after you think you're done. What does this tell you? Longer than 30 seconds to empty, weak or interrupted stream, need to strain, feeling of incomplete emptying. All of these are signs your prostate may be restricting flow. Other red flags, waking up more than once a night, sudden daytime urgency. These aren't minor annoyances, they're your body telling you something is wrong. Do this test a few times over a week. Track the patterns. This isn't about self-diagnosis. It's about information and awareness, which gives you power to take action. Let's talk about warning signs that mean you need to address prostate health now. Number 5, waking up multiple times at night. If you're getting up 2, 3, even 4 times nightly, your sleep is suffering, and that affects everything: energy, mood, mental clarity, overall health. Biology. An enlarged prostate puts pressure on your bladder. Your bladder becomes hypersensitive. Even a small amount of urine triggers urgency. At night, your body produces less ADH, the hormone that concentrates urine. Your irritated bladder is extra sensitive. Emotionally, exhaustion sets in. You avoid fluids before bed, which isn't healthy. Practically, life revolves around bathroom access. Sleeping next to your partner? Difficult. Rest? Rare. Multiple nightly trips are a clear red flag. Number 4, sudden urgency during the day. You know the feeling. 1 minute you're fine, the next you absolutely must find a bathroom immediately. That's urge incontinence, often caused by prostate enlargement and bladder irritation. Biology. The bladder muscle works harder to push urine past obstruction. Over time, it thickens and contracts involuntarily. Emotionally, embarrassment and anxiety. You start mapping bathroom locations everywhere you go. One patient, 66, avoided his grandson's baseball games because he feared an accident. He said, "I feel like I've lost my freedom." This isn't living, it's surviving. If this is happening, take it seriously. Number 3, weak or interrupted stream. Remember when your stream was strong and consistent? Now it may be weak, stop-start, or require straining. Biology. The prostate surrounds the urethra like a donut. Enlargement squeezes the tube, narrowing the passage. The bladder struggles to push urine through. Emotionally, frustration, self-consciousness in public restrooms. Practically, more time spent in the bathroom, avoiding situations without easy access. Number 2, feeling incomplete emptying. Finish urinating, zip up, then feel the urge again. That's urinary retention. Biology. Stagnant urine increases infection risk and can stretch the bladder, weakening it further. In severe cases, the bladder may lose the ability to contract acute urinary retention, a medical emergency. Emotionally, frustration, discomfort, feeling betrayed by your body. Practically, life becomes inconvenient. You never feel fully comfortable. Number 1, pain, burning, or blood. Non-negotiable. Pain, burning, or blood during urination requires immediate medical attention. These could indicate infection, inflammation, or serious conditions like bladder cancer or advanced prostate disease. Early detection is crucial. Here's the habit most men don't realize is making prostate issues worse. Caffeine and alcohol, especially in the evening. Caffeine increases urine production and irritates the bladder. Alcohol does the same, plus it relaxes muscles that help control urine flow. If you're already having symptoms, evening drinks and constant coffee are like pouring gasoline on a fire. Simple change. Limit caffeine to the morning. Avoid alcohol after 6 p.m. One patient made these changes and 2 weeks later said, "I'm sleeping through the night for the first time in years." Another mistake? Holding urine too long. Ignoring urges trains your bladder to be dysfunctional. Go when you need to go. Practical plan. Do the 30-second bathroom test. Track your symptoms for a week. Be honest. If you notice any of the 5 warning signs, schedule a doctor's visit. Early intervention is key. Make 2 small changes today. Limit caffeine and alcohol in the evening. Don't hold your urine unnecessarily. Dealing with prostate issues doesn't make you weak. It doesn't mean you're falling apart. It means you're human. You deserve sleep through the night, comfort leaving the house, confidence in your own body. With the right information and action, you can regain control. Hit like if this video helped. Share with another man who needs this advice. Too many suffer in silence. Subscribe for honest, practical health tips that improve life. Remember, you're not done. You're not too old. Small changes lead to big results. You're worth the effort. Take care of yourself. You matter.